Hi guys, it's Vaughn here with the Nurse Talk. And today I have a great video for you guys. It's a day in the life of a nursing student, clinical edition. So I usually leave my house around like 5:30 in the morning. And how I normally prepare to leave the house at 5:30 is I make sure I have everything the night before laid out. My lunch is already made, it's in the fridge. I usually make my coffee. I have to have my coffee. Then I get in the car. I have all my stuff sitting on my seat, my stethoscope, my notebook, my notepads, my pens, my papers. And then usually when we get to clinicals, we have a pre-conference and that lasts about 20 to 25 minutes. And then we get right to being on the floor. So you're looking at the Dynamats machines, and can't really record too much in the hospital. So that's why I'm kind of recording towards the ground and not necessarily on any patient's room or any proprietary information. Usually, what I like to do once I finish getting my assignment, our clinical instructor will give us our rooms as well as our nurse for the day and our patients. And then first thing is first, we would meet up with the nurse.
What happened?
We would get
What?
report with the nurse
Look.
from the other nurse that is leaving,
Nobody gotta know
and then it would be
what I'm
my job
doing.
as a student to go ahead and
Nobody gotta
do
know
the vital signs. Me and my
what I'm
classmate here, we're
doing.
having a good time. Um, and then also, of course, with contact rooms, when we have contact rooms, we'll have to put on our protective gear. We have to put on our gowns, gloves before we go inside the room. So here is a little bit of a room tour. Um, this is a clean, empty room. There's no patients in this room, of course. So usually what happens with these rooms, every hospital is different. So, we have the oxygen equipment available here. All the leaders are on there. We also have the beds, how everything is laid out in this particular hospital with this particular room. Now, of course, we have clinicals at various hospitals. So this is just one of the hospitals. And then now it's like break time, so drunk some water, had some fruit, a little light snack for break, and then back on the floor to work. So usually we'll do the vital signs for our patients. We'll also monitor their sugar. We'll check their blood sugar. We'll use the Dynamat to check their blood pressure, their temperature, um, their vital signs. All of that will be done with this machine. And then, of course, we'll clean it off in between each patient. So this is just me turning on the machine. And again, every hospital has different types of machines. This is just the one that they use here at this hospital. And this one doesn't actually go automatically to the computer system, so not my favorite. There are some hospitals out there where their machines upload directly to the site. So now we're heading to lunch. We usually go to lunch together. Um, and then after lunch, we went on a little bit of a tour. We're on the rooftop of the hospital, which is pretty cool. So when there's level 1 and level 2 traumas and they're flown in, of course, they're flown in and they land directly on top of the hospital to go right into surgery or into the trauma rooms in the trauma center. So this is us just getting a quick tour from one of the seasoned veteran nurses. So pretty cool, as far as being able to kind of be on the rooftop of the hospital. It's me and a couple of my classmates. We really enjoyed our tour. We kind of visited all the different areas of the hospital, which was pretty nice. So now our day is finally over. We do 12-hour shifts, full 12-hour shifts. So from 6:30 in the morning, we have to report, and we leave the floor at about 5 p.m. We have post conference for about an hour and a half until about 6:30 p.m. And then after that, we kind of talk about our patients, their diagnosis, treatment plans, and options, because we do have to go home and do a full report on our patients for that day. So it's about 6:30. We're all on the elevator heading up to our cars. Um, every clinical, I learn something different and something new, and I truly enjoy clinical experience. It's nothing like it. I mean, we of course are in class every single day, learning, but when we're in the hospital, we get to actually interact with those patients one on one, real life patients, real conditions. It really prepares us for when we actually graduate and are out there in the field. So usually, yep, we all just kind of say bye, see you guys on Monday. And I know this was a short video, but I truly hope you enjoyed watching. I couldn't film too much of anything in the hospital, but I hope you kind of got a little bit of an understanding of what it's like to be a nursing student, and also what our clinical days look like on a clinical day. So first semester clinicals are typically just med surg. So this particular day was a med surg day where we were on a med surg floor with patients that had various different conditions, pneumonia, um, severe headaches, or seizures. Those are some of the patients that I had encountered on this. So again, you guys, thank you so much for your support. Thank you for watching. If you enjoyed this video and would like to see more videos, please like, share, and subscribe to my channel. This is Vaughn with the Nurse Talk. Until next time, you guys, thank you so much for watching. Bye.